In today's deep dive, the granddaughter of former President John F. Kennedy says she's been diagnosed with terminal cancer. 35-year-old Tatiana Schlossberg writing in the New Yorker that she has acute myeloid leukemia with a rare mutation called inversion 3, something mostly seen in older patients. For more, I'm joined now by Dr. Stephanie Widmer, an emergency medicine physician. Dr. Widmer, thank you so much for joining me. Can you explain that diagnosis for us? What is acute myeloid leukemia, and how does that mutation complicate things?
So acute myeloid leukemia is a type of blood cancer. It originates from the bone marrow. It stems from immature white blood cells that start to just mutate and grow out of control and kind of crowd the healthy blood cells within the body. Now, this mutation or this subtype of AML that we're discussing here is a much more aggressive form of AML. It's much more difficult to treat. With typical AML, we're looking at a 5-year survival rate of about 32%. And with this more aggressive subtype, we're looking at a 3-year survival rate of less than 10% and really a median survival rate of about 8 months.
Now, one of the things that was notable is that Schlossberg says she didn't feel sick at all, and that doctors only noticed something was wrong with her blood count, that is, after a routine test after she gave birth. So how should younger patients know when to get screened?
Now, the thing here about AML is that there's no routine screening procedure for AML, unlike other types of cancers. AML is something that can come on rapid and very unpredictably. So the key takeaway here is that if you're not feeling right, if you're feeling fatigue that isn't going away and is really out of proportion to, regular baseline fatigue, if you're experiencing easy bruising, night sweats, weight loss that is completely unexplained, bone and joint pain. And the key here really is progressive and persistent. So if you're feeling these unexplained symptoms, it's really, really important to go get checked out by a primary care doctor.
Now, I want to talk about cancer as a whole. All right, Schlossberg, she's just 35 years old. A study from the American Cancer Society last year found Gen X and millennials have higher risks of developing 17 cancers compared to older generations. So which cancers are seeing the greatest increase, and do we know why?
So we are seeing a growing body of evidence that suggests multiple different types of cancers are growing in individuals under the age of 50. We're looking at colon cancer, breast cancer, kidney cancer, testicular cancer, and certain types of blood cancers. Now, there is likely no one reason why this is happening. It's likely due to a number of different things. There are genetic factors, and we can't prevent every cancer, but there are likely a number of modifiable risk factors, as we call them, as well, that are in play here. So things like diet, exercise, smoking, excessive drinking, these are all things, thankfully, we can control and we can help reduce our risk.
All right, Dr. Stephanie Widmer, thank you so much for that analysis.